Ask the docs, ask the docs, ask the docs, and we'll answer. Hello again, everybody. Thanks for tuning in. This is Ask the Docs, where we answer any questions that you guys have. So sometimes you guys send them in. Sometimes these are just common questions that people ask in the office. My question today is, how can I know if I have glaucoma? And are there any symptoms of glaucoma? So the answer is, it's really, really hard to know that you have glaucoma unless you get an eye exam. And that sounds a little, oh, you guys are just trying to get us in. But the fact is, we have to be able to check your pressure to know if your pressure is high. That's not something you can check yourself. That's not something you feel. People can have high eye pressure and they don't feel it. And there are also some other tests that we need to do to determine whether or not glaucoma is something that could be a potential problem. Glaucoma is very common if there's a family history of it. So if you have any uncles, aunts, father, mother, brother, sister, anything like that that has glaucoma, you're probably at higher risk. Age is a big risk factor. There are certain other things. But there's not a lot of symptoms for it. It's the silent killer. So, and we don't want to catch glaucoma when it's too late. So that's why we always stress a yearly eye exam so that we can know whether or not you may be at risk for glaucoma or whether or not you have glaucoma and need treatment. So just come on in.
Okay, the next question is, do my eyes get worse as I get older? How many times a day do you answer this one, right? There's a short and a long answer, so I'll give you the in-between. Yes, in a way they do get worse as you get older. What a lot of people are referring to is they're around that 40 mark and they've always had great vision and now they can't read anything and so they come to us and they need bifocals or reading glasses, that sort of thing. So we know that as you get older, the ability to adjust focus will decrease. And so if you grew up and you've always had great vision, well, very likely your distance vision will still remain pretty good, but your near vision will start to stink,
right.
And you need some help, and that's just a normal age-related change. As you get older than your 40s and 50s, you can develop some cataracts. You just mentioned that you're at a higher risk for things like glaucoma, so there are just some age-related risk factors that increase that can affect your eyes. Another really common one with our patients that are maybe 60, 70, 80 years old is your contrast sensitivity will get worse. And so these patients are always complaining that the newspaper, the color of the newspaper is not as distinct anymore. It's more of like a brown letter on a brown page, and that's contrast. So really good contrast would be a pearly white page with nice black letters. That's good contrast. The newspaper has very poor contrast. There's not a lot of color difference between the background and the letters. And as you get older, the ability to distinguish the difference in those decreases. So it makes reading and things like that a lot harder. There are different things you can do to increase the contrast. One is just good quality light on whatever you're trying to read. And certainly electronic devices help with that too. You can get the newspaper and magazines on like an iPad, that sort of thing. And also you can make it a lot bigger. So that really is a great tool for someone who really wants to read, that's in their maybe 70s and 80s, that's having some tough time with that contrast.
It's just the facts of life.
It's the facts of life. Yep, absolutely.
All right, guys. Thanks so much for tuning in.
Yeah, thanks.
Send us your questions. If you have any comments, leave them below, and we'll be glad to continue to do these.
See ya.
Take care.